3, 2, 1. Well, this is Greg with Texas Medicare Advisors. We are an independent agency that specializes in Medicare, long-term care solutions, and helping our clients maximize their Social Security benefits. Today, I wanted to do a short video on Medicare. Now, if you're like most folks trying to sign up for Medicare, it is so confusing. And between all the information you receive, between the mail, TV advertisements, the more you read, the more confused you get. Well, I'm going to break it down for you where it's very simple. The first thing you need to do is sign up for your Medicare. Well, all right. Well, when do I do that? Great question. Now, if you'll look here at this chart, you'll see that the month you turn 65, that's when your Medicare begins. So in a perfect world, you want to sign up before that. I recommend 3 months prior, if possible, so that your Medicare can start on the month you turn 65. Now, you can sign up on the month you turn 65, but it won't go into effect until the next month. And the longer you wait, the longer it's going to be delayed. So always sign up before and not after. Now, if you're like some folks that are still working at 65, you can actually delay signing up for your Medicare Part B until you retire, and at that point, it makes more sense to sign up for your Medicare Part B. Well, all right. Well, how do we sign up for Medicare? Well, technically, you can do it online, by phone, or in person, but I highly recommend that you sign up online through the Social Security website. That's right, you sign up for Medicare through Social Security. Now, if you're already drawing your Social Security benefits, you will be signed up automatically. So all you have to do is wait for that envelope in the mail that's got your card in it. Now, there are two parts of Medicare, Medicare Part A and Medicare Part B. Let's take a little closer look at Medicare Part A. What does Medicare Part A cover? Basically, this is your hospitalization coverage. Now, while it is great coverage, there are still deductibles and co-insurance that may have to be paid. But the good news is it only costs $0. That's right. Most people will qualify for this for free. As long as you've worked 10 years or your spouse has, you will qualify for Medicare Part A at no cost. Now, how about Medicare Part B? Medicare Part B is basically your physician visits, medical equipment, and mental health care. Now, most folks are going to pay $148.50 for this. This is your standard premium. But if you're a high income earner, you will end up paying more for this, and this is certainly a discussion we want to have. And again, just like Part A, Part B is good coverage, but you are still responsible for 20% of any medical bills, and the government pays 80%. So that's why it makes good sense to get a Medigap policy. All right, well, let's talk about your next step, and that is choosing a Medicare Gap or Medicare Supplement plan. Now, as you'll see here, we have Original Medicare, and also Medicare Advantage plans or Medicare Part C. This is a little different animal, and for the purposes of this video, we're just going to talk about Original Medicare and getting a Medicare Supplement insurance or a Medigap. That's the same thing, just two terms that makes it a little more confusing. And you want to get a Medicare Part D drug plan. So how do we go about this process? Well, if you've looked at any of the books, it's totally confusing. There's more alphabet letters there than necessary. So let's make this a little bit more simplified. We know that today the most popular plans for folks turning 65 is Plan G and N. Now, Plan G is the most comprehensive plan because it covers all the deductibles, all the co-insurance, And it even covers your first 3 pints of blood. Probably didn't know you had to pay for that, but you do. The only thing that it does not cover is the Medicare Part B deductible, which this year is $203. So this is Plan G is your most comprehensive plan, and also Plan N is another very popular plan because it's a little more cost effective, but you do have some additional cost there, like $20 copays when you go to see the doctor, and a $50 copay if you go to the hospital. And it doesn't cover Part B excess charges, which I'm not going to go into on this particular video, but we can talk more about that later. So these are basically your two Medigap options, if you will. All right, and then step 4 is you need to get a Medicare drug plan. Now, how do you know which Medicare drug plan to get? Because there are so many of them. Well, the best way to do that is simply give us your prescriptions. We can run that through our program and find which particular Medicare Part D drug plan is going to be best for you based upon your prescriptions and your desired pharmacy. Now, what if you don't take any prescriptions? I don't need it. Well, yes, you do, because if you don't have a Part D drug plan, then you're going to have to pay a penalty for the rest of your life until you get one. So we recommend always getting a drug plan, and those plans, if you don't have anything, there's one that's only $7.30 a month, and it's well worth the purchasing of a drug plan. Now, what does Medicare not cover? Commonly question that we get a lot, and those things that Medicare doesn't cover are dental, vision, and hearing, and long-term care. Now, the last time I looked at my clients, most of them have teeth, eyes, and ears. Those are all things that they're going to need help with, and we recommend that you look at an insurance policy to help you protect those valuable items of your body. Also, long-term care. Long-term care is not covered by Medicare. We urge you to get a long-term care strategy, and that's what we help our clients with, is developing that in a very cost-effective way. So those are things that are not covered by Medicare, but it doesn't mean that you can't protect yourself on these issues. Now, you probably have lots of questions. That's why you should call us. At Texas Medicare Advisors, we'll be happy to answer any questions you have about Medicare and what's the best route for you. So give us a call today, 512-900-3008, and we will be happy to answer any questions that you have and look forward to being of service to you. And remember, it doesn't cost anything to use our service because we are compensated by the insurance companies to help you get a plan that fits your needs and budget.